you have another book coming out soon about gum disease. Can you touch on that a little bit and maybe some of the things that people think they know but don't?
So the new book coming out is Cure Gum Disease Naturally. I think just like with the story of bacteria for teeth, there's a story of bacteria for gums.
Sure.
What's interesting about the story of bacteria about gums is that the latest literature that you can read in the textbooks, but the dentists aren't telling people, says that it's the host response and not the bacteria that causes gum disease. In other words, the little guys might be there, but it's how your body reacts to it. And that's what's happening with tooth decay. The little guys are there, how your body responds is what's important. So the main thing is to think about this idea. Your body is responding to something. The main cause of gum disease, so what is happening in people's mouths? That their gums are inflamed. What is happening is their jawbone, where their teeth are implanted in their sockets, is deteriorating. So when you remember the 70 to 500 pounds of force per square inch you're chewing, and the bone under your teeth gets a lot of stress and movement and all kinds of different things happen. So that bone needs to build up very quickly. It needs to rebuild, it needs to rebuild, it needs to rebuild. So people eating too much sugar, they're not rebuilding. They're not rebuilding, and they're chewing and chewing, and then that bone starts dissolving. So gum disease is the dissolving of the jawbone. And so just understanding that is a big piece of the puzzle. And many things related to tooth decay also relate to gum disease. So people are consuming too much sugar. Gum disease is a symptom of diabetes. You can directly correlate people's blood sugar level with how severe their gum disease is. And likewise with tooth decay, we want to give them back the fat-soluble vitamins, which are not in our diet, the A, D, E, and K. And the way you get that is with real grass-fed butter, with fermented cod liver oil. That's the best way. You can also get it from fish eggs, possibly bone marrow. And people need calcium. Gum disease is generally a severe calcium deficiency. And there's different kinds. There's the acute deficiency that happens faster, and then there's the slow deficiency that slowly over years. Women get this often because their minerals went to their baby, then they breastfeed, then they exercise, they don't eat enough, and they start losing calcium and their teeth get loose. And the message is both tooth decay and gum disease are a problem of faulty body chemistry that started primarily from not eating the right food and from eating too much sugar. When you repair the problem of faulty body chemistry, for some people it's easier who are in relatively good health. For some people it's harder because their digestion may not be good. They might have all these toxins. They might have mercury toxins, vaccines, the pharmaceuticals. But the bottom line is when you repair your body chemistry and eat the right foods, calcium is important, and the fat-soluble vitamins are important to use the calcium, and the kelp is important for trace minerals. And this is just the key points. When you eat the right foods and eat enough calories, the cause of the disease stops. So the gum disease stops. The infections will go away.